Laser Pulse is brought to you by BW Tech Medical, a leader in light-based devices for over 30 years. Whether you're a researcher or a manufacturer, we help turn ideas into reality. Learn more at www.bwtechmed.com.
Welcome to the latest episode of
Laser Pulse,
where we explore the development, current state, and future of light in medicine. We do that by inviting thought leaders, academics, researchers to have an open discussion about where they are in their PBM journey and where they see PBM going in the future. Today, we're going to focus on PBM in veterinary medicine. My co-host, Dr. Pryor, is particularly and peculiarly well qualified to introduce our speakers and interact with them. As co-founder of LightCure, he was really responsible for introducing PBM into the veterinary profession as far back as 2006. So Brian, why don't you tell us a little bit about that journey and introduce our guest?
Yeah, so in 2006, when we started LightCure, first of all, welcome everyone. Welcome our guest. It's great to have you here. I'm very excited. In 2006, we were, looking to bring PBM out and focused on getting to medical, but, in our journey learned that the veterinarian, community was receptive to lasers. CO2 lasers were kind of on their way up. So the explanation of the physics and things wasn't far reaching. And then, we jumped into the equine business right away, kind of maybe a blunder in 2007 as the economy was going the wrong way. And the equine market was, as goes with the economy, I think, going a different way. But lucky enough to almost stumble upon the small animal companion market. And I think fortunate one that vets are easy to work with, as you'll see with our guests here. They're fun to work with. They try stuff, they get stuff. And then two, I think we were an alternative that was affordable when dogs had, arthritis or maybe a potential TPLO. You can use the laser and, people were charging, $30, $40 a treatment to get their dog out of pain, with a laser. So it was affordable to the veterinarian to offer and making some income, but affordable to the clients to pay. And so I think timing was right. And certainly we leveraged that and learned a tremendous amount, as you'll hear from our guest, as well as stuff that they've written, and as many other veterinarians have written and published. It's really helped the, PBM market and application tremendous. We have a lot to thank our veterinarian colleagues for getting PBM to where it's at because of their willingness and ability to do good science and try it on many different applications.
So we have with us today Dr. Lisa Miller, who I counted as a friend for probably, 10, 12 years, Lisa, maybe more, something like that.
Yes.
Lisa, why don't you just introduce yourself a little bit and talk a little bit about how you came to PBM?
Sure. Thanks, Andy, and thanks, Brian, for having us on the podcast today. We're really excited to be here and appreciate it. As Andy and Brian said, my name is Dr. Lisa Miller. I am a veterinarian. I do work full-time for Companion Animal Health now. I am their Vice President of Clinical Veterinary Medicine. I originally started with lasers probably back in 2007 or 2008 when I was in veterinary practice for rehabilitation and sports medicine. I was certified in that. So I worked primarily with dogs, sometimes with cats, and really started out using laser therapy with lower powered 3B devices, because at that time, there's probably still more of those on the market. And then quickly advanced to using class 4 lasers and ultimately came to work for Companion Animal Health as their veterinary medical director. Really enjoy teaching and doing research. And one of my main goals in this role has been to try to instigate and promote research in the field so that we could really go from having more of a body of sort of anecdotal evidence and clinical feedback from, of course, our colleagues, which is definitely part of that clinical pyramid of evidence, but really promoting research and good, peer-reviewed publications and more sort of scientific writing about the subject. So it's just a little bit about me.
Yeah, thanks, Lisa. And Dr. Winkler, we've known you for now probably just a little over a year, been out to your practice in Long Island. Could you speak to a little bit about your journey, maybe a brief bio, and what drew you to PBM and the use of lasers?
Yes, thank you. Thank you for having me here, Brian and Andy. It's wonderful to see you again too, Lisa. My name is Dr. Christopher Winkler. I'm the owner of Suffolk Veterinary Group, Animal Wellness and Laser Surgery Center on Long Island here in New York. I got interested in surgical lasers around 2010 when a vendor stopped by the practice and introduced me to it a little bit and talked to me about the potential for its use. And it was just a very intriguing instrument to kind of set us apart from other surrounding general practices. And we took it on and began promoting it in all of our surgeries. I think that was the key, was just including it in every surgical procedure we could possibly do. And that certainly helped me to get more familiar with the instrument. And I just became fascinated with the science and the physics behind it and just wanted to learn more and more. And it was venues such as AIMLA that helped me to learn more about it with their online classes. That certainly made it very easy to not only take some coursework, but also network a little bit with other doctors. And I started meeting some others and attending in-person classes locally, such as John C. Godball Jr. And that got me kick-started off into the field, and it's been a wonderful journey since then. And we extended into PBM soon after.
Brian and I have been lucky enough to sit in on you perform a couple of surgeries, and you and your excellent technician, by the way, who happens to be your wife, it's almost so robotic. I don't want to say it's like a production line, but it's so efficient. I mean, you have the handpiece that here comes the smoke evacuator. And then the surgery is done so quickly and with so little blood, without so little fuss.
Mm-hmm.
It was very impressive to see. And from what I understand, there's less pain and faster healing for the pet. So help me understand why more of your colleagues don't adopt laser as a surgical tool and still stay with a scalpel.
That's a very interesting question. I wish I could ask them sometimes myself. We've approached the university level, and they consider it difficult to incorporate into the curriculum when you have, say, an instance where you would not use laser because you have no time to reach for it in an emergency situation. Or if the lights go out, there's no power. What are you going to do if you need electricity for the laser? So you do need that kind of basic aspect of your training and then expand on it from there. And I guess they still expect that to go on after your clinical year in veterinary school. It's certainly a wonderful place to learn. All of the teachers that I've encountered in this field have been absolutely wonderful and open about sharing their knowledge of the subject and very eager to do so. We do kind of wish that it took place a little bit earlier in a curriculum because a lot of these students are frankly expecting to encounter this kind of technology when they get out there and start practicing.
Right, thank you.
And Lisa, do you see a parallel kind of with the CO2, I think adoption rose very, very quickly and kind of flattened out where PBM really kept going? Do you see like what's the main reason for that?
I definitely see, some differences, as Chris mentioned, in the education in veterinary schools, particularly, unfortunately, there have been less and less sort of practical hands-on um, curricula in the veterinary school programs with regards to surgery. And so I think not only is there not surgical laser being taught in veterinary colleges, but less actual hands-on surgeries being done now due to limitations. So I think one of the reasons that PBM is fortunate not to have experienced, that sort of plateauing and falling off is that it can be administered mostly by nurses. It's a technology that is administered mostly by the nurse as prescribed by the veterinarian. And then the veterinary technicians really have championed the technology and are the ones to perform it with the pet owners, in the rooms. And so I think that has made it easier to use because you don't have to be the actual surgeon performing the modality. And that has, certainly led to its ease of use in practice and its adoption for sure.
Yeah, that's great. And what have you guys seen for PBM, right? I know, Lisa, you were involved with a pretty big undertaking and data collection from companion customers, looking at all types of applications. But, from that study and Chris, from your personal experience, right, seeing patients in your practice, what's kind of the, 1, 2, 3 applications that you're seeing people that you're using PBM for in the clinic?
I think categorically, I like to think of 3 different categories of conditions versus specific conditions. I think that the first sort of main category that we see PBM being used is in, musculoskeletal and orthopedic applications, primarily osteoarthritis, pain management, but certainly soft tissue injuries and even things like fractures and bone healing. The second main category would be post-operative and post-dental procedures, to decrease pain and inflammation and help increase healing, decrease surgical complications and that sort of thing, decrease pain after dental extraction. And then the third main category would be probably its use in acute dermatologic or acute condition settings, meaning things that sort of come on rapidly and cause a lot of pain and irritation to our patients and secondarily a lot of concern and sometimes annoyance for pet owners. So things like ear infections or anal gland infections, things like acute diarrhea or pancreatitis that can be quite painful and uncomfortable to the pet as well. And things like even urinary tract infections and urinary issues in cats. So I think those are the 3 main categories that I see the technology being used, but definitely would want Chris to chime in here as well.
Lisa's absolutely correct, and in the correct order too. We first do mostly musculoskeletal procedures in practice. One of our longest running PBM patients is a musculoskeletal patient with chronic CCL tear. And she's still walking on all 4 legs, just approaching very deeply into her geriatric years and still going strong. We most often use the lasers otherwise post-operatively, immediately after a procedure. Most of our procedures do receive a dose of PBM, and we credit it to at least a 25% faster healing time with much less scarring. So it's wonderful to see, and they're in a lot less pain walking out. So we love to see the combination of surgical and therapy laser being used in the operating theater. That's been terrific. And then the chronic use of on conditions such as ear infections and then diarrhea. Urinary tract infections are a big one, especially in the cat, who does seem to take to PBM very well. That's great to see. And then one more that I think should be credited is rehabilitation in sports medicine. We don't often see such patients, but we do have a few, and they do appreciate what PBM can offer them.
Yeah, that's great. I love it. All laser all the time. That's why we get along so well. Follow laser with laser. I love it. So Lisa, you've seen, I think came to Companion pretty much mid-journey, right? And gave us a lot professionalism and training and really helped our education throughout and our research, right? Dialing in our research. And so I think when you came aboard, we probably had a 15 watt or maybe even a 10 watt laser, and now it's 25 watt, and even on the medical side, they're going, as high as 40 watts. So what's your thoughts of that evolution? Um, why do you need it? Do you need it? What's your thoughts? And even going farther down, you're seeing a lot. Maybe I'm targeted, right? Because I search laser everything. But I'm seeing red light therapy, a lot of these little take home for your pet. And it seems like they're everywhere. Kind of lead us through kind of from that low power to that high powered, what might work and why.
Sure. Thanks, Brian. It's a really interesting question and sort of topic in general. I think we've seen the evolution to higher power devices for a couple of reasons. I think, initially we probably saw it more from an efficiency of time standpoint and the efficiency with which you could deliver a larger dose in a shorter period of time, just making it easier to treat multiple areas, which of course most of our patients, at least from an orthopedic standpoint, don't just have one joint with arthritis. They usually have multiple areas that are painful and need to be addressed. And so from that standpoint, it was more efficient to treat with higher power because you could do so in a more succinct amount of time. But as we have come to understand dosing, we now know that in order to get consistent and efficacious clinical results, at least with deep tissue conditions, that having good clinical results is really a function of, both your fluence, which is your energy density or your joules per centimeter squared, as well as your irradiance or power density, which is your watts per centimeter squared. And so it is not just simply the total amount of energy that you deliver to a particular area, which is what we used to think. And now we know that in order at least to have a good results at depth, you really have to have that higher irradiance as well, right? And the only way to really achieve that with laser devices is to have higher power devices. And so what we've really seen over time is this evolution in dosing recommendations and sort of this, increase in dosing recommendations, again, for deep tissue conditions. And so I think when we start talking about the popularity of red light devices, and ease of access for pet owners and things like that on the internet, it's kind of a double-edged sword, right? The positive aspects, at least to me as a veterinarian, are that our pet owners and clients are now more aware of the potential benefits of photobiomodulation or of visible light red light therapy. The downsides are of course that unless you understand dosing, you might have the impression that results will be equal between things like red light devices and low power devices that you can buy, through online retailers for your pets for pain. And that is really not true. I don't think that we don't get equivalent results at all. And the results in the literature seem to indicate the exact same thing, especially for deep tissue conditions. We really have to have that higher power. So, I think it's good that people are learning about red light devices and learning about infrared light and the benefits of light and its use in medicine. But, as veterinarians, we still have to really do a good job educating our pet owners, both so that we can treat the pets with the best medicine, but also, help our clients not spend money on something that's not going to work or potentially put their hope in something that is not going to work for their pet. But I'd love to hear Chris's perspective as well.
Chris, are you seeing clients come in and saying, "Hey, what about this?" That they've seen it other places?
About that, and also they're getting referred to us now from other even boarded surgeons, which has been great. One found us on the internet after being recommended by her surgeon for PBM following a CCL repair on the knee, and the dog was still having difficulty walking. And she came to us seeing our experience on the internet and our familiarity with both surgical and the PBM devices. We gave this dog a single treatment, and she noted an improvement within 24 hours. And I remember the surgeon also calling us and being very impressed too. He was very pleased with the outcome. So the interest is there, and as long as the clients are finding out about it or being told about it, they do seem to be eager to seek it out. And as long as we're available to offer it, I think that we certainly can give these pets an improved quality of life with this technology.
That's excellent. And Lisa, you're seeing, as a horse owner and horse enthusiast, as well as, having a equine focused product, are you seeing, like I'd imagine in that market, right, a lot of people are buying things, over the counter and trying all kinds of things. So it's probably even more confusing in that space.
Absolutely. Yeah, absolutely. I mean, I do think, that was one of the downsides, even as you mentioned early on, with the sort of introduction of lasers into veterinary medicine. The equine market had been inundated very early with low power devices. And while they did appreciate some improvements with things that were superficial and wounds and that sort of thing, it really didn't require that higher power for efficacy. We can definitely see how that would be a challenge to appreciate more clinical results with pain and deeper tissue conditions in a horse, and so because of that, there was a lot of talk in the market that lasers didn't work, right, for horses for pain and orthopedic stuff. And so it's been, a bit of a challenge over the years to really kind of come back and explain why that is, and for some people to have take a second look at using the technology in horses for deep tissue conditions. But I think now that, more people are learning about that, looking into the research and seeing, the potential reasons for not appreciating early success, that we've been really able to start to overcome that. And that's great because it can be very beneficial for them as well. And, much like our feline patients, we are challenged sometimes with pain management options in the equine world. And I think it works really nicely for them for some things.
And so you guys are kind of the new editors, right, of the new edition, the second edition of the laser therapy text, which is great. I think the first one really shone a light on PBM and did a good job of educating. Interested in, it's a long journey. I know editing a chapter, editing a book is relying on a lot of people, and I think often herding cats is, I've heard, thrown around a lot. Me being an author of chapters and tormenting some editors in the past, so I could feel for you. But in that journey, what new did you learn about PBM? Like, I'm sure you read chapters. Like, what surprised you, and what new did you learn through that experience?
I'll let Chris go first on this one. I'm interested to hear his perspective.
I have to say that the journey was wonderful in not only meeting Dr. Miller, but also learning a lot from her. And it's been such a great pleasure to collaborate. I think that the cornerstone of this new second edition will be her chapter on oncology. And the new advancements and what's come to light over the past several years since the publication of the first edition on the use of PBM for cancer patients, which has been for a very long time a no-no as far as a limitation on what PBM can be used. And what we're suggesting now is that you consider using PBM not only for pain management in a chronic oncology patient, but also to help to benefit the patient in ways we haven't thought of before. So I think that the book will be very eye-opening for new readers and first edition readers in that regard. And we're very happy to bring it to them.
That's great. Lisa, how about you?
Thank you, Chris. That was very kind of you. I echo Chris's sentiments just as far as my enjoyment in collaborating on the text with him was just it would not have been possible. I could not have picked a better co-editor. So thank you, Chris, for all of your guidance and hard work as well. I am very excited about the PBM in veterinary oncology patients chapter, collaborating with veterinary oncologist Dr. Chelsea Tripp in Seattle, Washington. We did quite a deep dive on the potential risk versus benefits of using photobiomodulation in patients with cancer. And we did, as a result of that, quite a bit of diving into its use in human medicine to manage the side effects for a lot of different cancer therapies, including radiation therapy for radiodermatitis and lymphedema for human breast cancer patients and things like that, oral mucositis. And a lot of those side effects are similar side effects in veterinary medicine as well. And a lot of our patients experience some of the same comorbidities that human cancer patients suffer from. And having a technology that can be applied non-invasively to our veterinary patients to help manage things like diarrhea or cystitis, sometimes from chemotherapy, is tremendously helpful to their quality of life. So I think, one of the biggest differences in how human oncology patients and veterinary oncology patients are managed is really more of a focus and emphasis on the quality of life, because we don't use chemotherapy doses typically that are as high and have as many side effects as they do in human medicine. And because that quality of life is so emphasized, having a tool that we can reach for to manage these things in patients, now supported by evidence, such as, the large bowel diarrhea study that Dr. Joa Alves and his colleagues in Portugal recently published, those kinds of things are just tremendously beneficial for these patients, and really give us something to consider that we have not considered before. But there are some other really interesting, new fields of research looking into the impacts of PBM on the microbiome in the intestines is pretty interesting, as well as potential transcranial uses for everything from cognitive dysfunction to potentially anxiety-related behaviors in dogs, and then certainly all of the neurologic applications are just really exciting. And I'm hopeful that, one day we'll get there in human medicine as well. But I think we've got some exciting new content in the textbook that our authors have delved into. I think we've got some updates on research specifically in the vet med field. And I think I can speak for both Chris and myself when I say we're very excited about the new content that's in the second edition. So
I think this would be a great moment to just talk about the book a little bit. I've seen that it's available online. It's finished, which must be a great weight off your shoulders. It's available for pre-order online, but I believe it's going to be available in May. Is that right? Is that
correct?
Yeah. And I think it will also be worth mentioning a couple of things. First of all, the original book, which you've taken, that raised the bar on safety and efficacy incredibly. And it must be said, there's thousands of those out in the field.
absolutely.
So you're elevating the bar.
And thank you, Andy, for mentioning that. And we would be remiss if we did not mention and thank both Dr. John Godbold and Dr. Ron Riegel for really putting that first edition textbook out there. And there was nothing in one place that had such a comprehensive overview of the technology, the benefits, the evidence. And that was a massive undertaking at the time, which doesn't seem like it was at this point 8 years ago, but it was. And without them, I don't think the technology would be where it is today. The education in the field would be where it is today, and research today. So we really owe them, a big debt of gratitude, and also personally for, mentoring at least myself. But I think Chris.
No, I think that's definitely worth mentioning. You touched on it in your opening. discussion about basically up until that point, it was anecdotal evidence that we were really using to drive dosing and to drive our strategies. But then the book came out after, which really changed everything. And I think we would also be remiss if we didn't mention that Dr. Winkler also wrote a handbook on laser surgery, which
Yes.
also changed the game for veterinarians. I mean, that was no mean feat. Did you want to just touch on that journey and what you learned from that, Dr. Winkler?
Thank you for mentioning that, Andy. But once again, we have to give John and Ron Riegel credit for that surgery book as well.
Okay.
Wiley became so excited with the laser therapy text. They started asking Dr. Godbold and Dr. Riegel about a surgery book to go with it and partner with it. And they had recommended me to Wiley to undertake that. And that was just an honor on my part to be recommended by both of them. So that book was probably the natural progression in a laser textbook series for veterinary medicine and surgery. And we were very pleased with the results. The opening, much in a similar way to the laser therapy text, goes into the technology and physics of laser surgery, the safety aspects in the operating theater, and a little bit on PBM and its use in the operating room. And then goes on to discuss specific cases in general and specialty practice, spays and neuters, ophthalmology, oral surgery, dermatology, and even a little bit of neurology as well. And then it moves on to equine and exotic animals. So it kind of mirrored the first laser therapy text, and we're looking forward to see how it can continue to be developed in the future.
I think that the profession owes you a debt of gratitude for bringing good science and good practice. I think you both deserve a lot of credit for really trying to bring scientific rigor to the use of lasers, both surgically and therapeutically.
Thank you.
Do you guys have any tips for some listeners, veterinarians out there using PBM or maybe not using PBM that, you know, they could a quick new tip that you've learned that you can implement tomorrow? Cancer is a great one, right? And I love the field. I'm involved with a company doing mucositis treatment. The results are fantastic. I think the difference in vet medicine, and I think the advantage we have learning from vet medicine, is you have access to the patients. Right. And I know specialty is changing the game a bit, but you're likely to have a cancer diagnosis all the way through treatment in your practice, right? Where human medicine, someone's doing surgery, maybe a dentist is focused, sees you and you have mucositis. Maybe it's your GP. It's really hard to really, get the patient in the same treatment regime because there's so many touch points. So I think we can learn a lot and hopefully translate some of these things that you're learning to show people like, hey, we have results. We just need to change the workflow a bit. And hopefully they're responsive to that. But is there any kind of, some tidbits that people, you've seen in teaching or traveling clinics that they can get more out of it?
I think that what I would say first to a general practitioner is to have a dedicated person, such as an LVT, available to administer the PBM. If you have a high case workload or a rapid progression from one case to the next, then having someone just behind you with the PBM unit ready to administer to a patient you've just seen can be incredibly easing on your schedule, and yet also a greater service to the patient and to the client. Just making that available, we've discovered so much about how much we can treat with PBM, and the more that becomes available to us in our repertoire and our toolkit, the more we just need someone to be there to administer it, and it's harder to do with a smaller staff. So if you do have a dedicated person, I think that would be tremendously helpful.
Yeah, that's great advice. And we've seen that, right? There's nothing like when a technician has a personal story, right? And seeing, a dog that came in dragging their back legs and then, after 8 or 9 treatments, walking almost normally again, it just breeds, right? It's contagious. They tell everyone about it. They do a great job handling the animals. I totally agree with that. Lisa, anything from you?
I think to that point, because it is so contagious, once people, have that first case, right, where they see such a dramatic change, is really we need to shift our thinking from should I or can I laser this to why shouldn't I laser this? In fact, one of our clinics had like a little framed cross stitch in the hallway that said, "Have you lasered that yet?" And then one of our other customers, actually, I have to credit Dr. Jorg Mayer at the University of Georgia for this, but he suggested that everybody should have, just like you have on your dishwasher, a little magnet that says clean or dirty. It just should say, like, has this patient been lasered? Yeah, yes or no. And then have that on every cage door in the treatment area, because they're really, if we stop, thinking about in specific conditions and whether or not we can laser that condition, we should start thinking about it more as a physiologic tissue, right? And is this tissue inflamed, painful, or in need of healing? And can I get a therapeutic dose of light there? If the answer is yes, then we should be treating it, right? We should just be lasering. We should just be lasering it, because it's such a breadth of things that we can help with. So
Excellent, excellent recommendations. I think that, and you see practices that have, been laser customers, they step up in power, they're all doing that, right? And once it catches on, it really catches on and becomes a fabric of the practice. So that's great to see. One last question we ask everyone, kind of what gives you joy about, this field, and why in it, why doing it? And, we share with all our guests here.
I think just watching my patients walk out with just a little bit more spring in their step than when they walked in. They feel better. They're more comfortable, even after a surgical procedure, to experiencing less pain, less inflammation, and the benefits of the PBM along with it, just making them feel better. That's the way that surgery should be progressing. It should be progressing to a completely pain-free option if the technology is available there, why not do it? So I'm very pleased to be a part of that, and the collaboration that I have with colleagues in this field is just the icing on the cake.
I think the collaboration with our colleagues and sharing our stories of success and just seeing the successful cases, I think for me it's transition, now that I am not in private practice any longer, but I have the benefit of being able to see the case photos and videos from my colleagues that share their success stories with me of, hey, you recommended that we treat this patient and look at how it's doing now. And especially in those dramatic cases that we've all, seen personally and otherwise, where, we have a patient that may have otherwise been facing euthanasia or, something else. And to see them again, walk again, breathing easy, that wound is healed and they're playing again. Like it still is, it still gives you that great feeling and that feeling of gratefulness that we have this technology available to us in veterinary medicine to be able to treat things again that I really wish that we had on the human side. I wish we could treat things like thermal burns and other things with PBM that we are able to treat in vet med. I think it's great. So
excellent. Well, thank both for your time. Just to recap, I think we've learned a lot from our veterinarian experts here, that vet medicine really took on to PBM and lasers in general and really have led the way. And you're right that a lot of human medicine is, a little behind. We're coming there. Like I'm involved with a lot of different applications and hopefully, we get a lot to market because it can help a lot of people. And people certainly should watch out for the book. Um, knowing these two, it's going to be fantastic, I'm sure. I'm looking forward to it and looking forward to those new applications and, encouraging others to look for even more, right? Because it is gonna help the whole medical field at the end of the day. We'll take it into human medicine somehow, kicking and screaming to get things that work. But good science, good studies is important. And I know that you two, sing by those same praises, right? This is why we work together a lot. We all have the same philosophy, right? Good science will breed good applications and get things to help people and pets. So thank you very much. Does you guys have any last closing thoughts?
Oh, thank you very much for this opportunity, and we definitely look forward to discussing with anyone interested more about the physics behind it and the applications that are available to you now. Please contact us should you have any questions. Thank you.
Yeah, echoing Chris's sentiments, thank you guys both for having us on today and being able to discuss it. And we're always excited to share information with our colleagues, as you both know, and appreciate both of you as well, especially you, Brian. I know we thanked Ron and John earlier, but this technology wouldn't be where it is today without you either, and we really appreciate it.
We do.
Oh, thank you. Thank you very much.
Yeah, that's lovely. I would encourage any listeners to, if they have any questions or concerns or thoughts that they would like to share with either of our guests or any of our guests or Dr. Pryor, then info at AIMLA, American Institute of Medical Laser Applications, info at AIMLA.org. And that is a great source for a lot of training to raise safety and efficacy of laser therapy. And it's an online resource for largely veterinary professionals who are looking to further their education. I would again reiterate Brian's point. The book is that it's not one of many; it's one of two, and it can be literally described as the Bible for this aspect of the veterinary profession. And all credit to both of you for bringing that forward. And I would encourage people to pre-order right now because it'll be out in May, and I'm sure it won't be updated for another 8 years. It's going to have longevity, that's for sure. So thanks everybody for watching, and we'll see you next time on Laser Pulse.
The book discussed in today's episode, Laser Therapy in Veterinary Medicine, Photobiomodulation, 2nd edition, is now available at wiley.com. Visit their site to learn more and get your copy today.